What efforts are in place to help health system pharmacists achieve provider status?
So I mentioned earlier that provider status was the biggest legislative issue for pharmacy right now, and it really is. It's across the board. Virtually every pharmacy group, whether it's membership or chain drugstores, et cetera, is really focused on this. We have legislation both in the House and the Senate to do what I mentioned earlier, recognize pharmacists under Medicare Part B. So recognize them under the Social Security Act as being providers like physicians, nurse practitioners, physician assistants, audiologists, anyone else that's currently recognized under Medicare as a non-physician provider. So this would give them that recognition, but really importantly, what the bill does that we're working with is it allows for these pharmacists to practice for Medicare beneficiaries in medically underserved areas, medically underserved populations. So this isn't looking to compete with traditional primary care. What it's doing is to say in areas where there is a lack of access, where the most vulnerable populations are living in the Medicare population, they now have access to the pharmacist care, and those pharmacists will be recognized by Medicare. So it really is, what it really means is that pharmacists will be able to do, essentially everything they're currently doing, but do it for all of their populations. So the bill has, over 130 co-sponsors in the House, for now the number in the Senate. So it's a lot of interest in this. And the coalition that's working with this is, I think, 30 or so members large, and it includes, like I mentioned earlier, virtually all the national pharmacy stakeholder groups, individual chain pharmacies, individual pharmacies themselves, and some others we're really excited about too, like the World Health Association. So there is a big effort legislatively to move these bills forward and to move them through the process. So that's really what's going on with it. And there's a lot of grassroots efforts from our members, and we're here at this meeting and other meetings. We're putting the call to arms from the members to get out, contact their legislators and get involved. And we have a whole grassroots team that's working diligently on that to kind of get the membership really involved in this, because it's going to take members to make it happen.